You've seen the notes.
Thank you.
Well, I feel like
We'll be getting started soon. We're just dealing with some technical
Gotcha. Cool.
No
delay.
problem.
I'm down the rabbit.
That's a fun rabbit hole to be in.
It is. Took the red.
Yeah. Gosh. It's a tough pill to swallow, man. It's the right one.
It is. It's.
Gosh. I feel like I live in that movie right now. It's wild, isn't it?
And then I have like people that I'm in contact with every day that just are so like not awake.
Mhm.
Listening to the guy I work with, they're like, we find a vaccine for this. We can't believe there's people that don't want to take it. I'm just like, oh my god, bro, we can be like on more opposite sides of the page.
Yeah.
Like, crazy.
All right, so I'm gonna do a YouTube live, but I'm going to post the link on
Facebook.
Facebook.
Gotcha.
Gotta pivot.
Pivot.
All right, so we're doing that.
A lot of windows open.
All right, I'm gonna hit record. All right, let's get rolling.
Okay, say when.
All right, we're live.
All right, live there. All right, let's go. Let's do it.
Right, we're live here.
Hitting record live on
You got a tablet you can hold
YouTube.
outstretched arms, right?
Okay. All right, so welcome everyone for joining us on our Wednesday night health optimizing health webinar. I am with Dr. Casey. I am Dr. Calvin Ng. We are at the Cohen Health Institute, and we also have Dr. Blair on the line. Let's just have everyone kind of like introduce each other, and then just to get to know all the docs. Casey, go ahead.
Sure. I'm Dr. Casey Pride. I'm a chiropractor. I'm also certified in applied kinesiology, and I do quantum neurology and also foreign specific technique. So I consider myself a holistic physician, and I use a lot of manual muscle testing to find exactly what needs to be corrected and to make that correction.
Awesome. And through this, and we're also gonna yell because we got like multiple devices, so we're gonna yell and make sure like people are getting it. Also, Dr. Blair, let's have you introduce yourself.
Hi, everybody. It's Dr. Blair Milo. So I'm not in the house tonight. I'm back in Georgia visiting my family. So I'm not at the CHI right now, but I'll be back soon. I am a chiropractic kinesiologist as well. I am certified in various different techniques. I practice quantum neurology, neuroemotional technique, contact reflex analysis. Oh, did that work? Perfect. And yeah, I just love treating patients holistically, just like Dr. Casey. Hang on. That was creating more noise.
Yeah, that might be, yeah.
I don't think it's gonna work. It's okay.
Oh, okay, got it. So Jesse turned his volume down, so we should be good. So
Okay.
Jesse got it figured out.
Okay.
Yeah, I know. We're trying to figure out all this cross-platform streaming stuff, but yeah, awesome. And Dr. Blair is taking a little break and vacation in Atlanta where there is no shutdown, so we're all jealous. But we're happy that she's on tonight, and we wanted to talk to today. Well, actually, let me introduce myself. I'm Dr. Calvin. chiropractic kinesiologist, and I put together this webinar, and the webinar is really for the people of Cone Health Institute, the people of this community, the people who want to find out what we do. I wanted to provide a resource for people to be on here. We normally have a Wednesday night health class every Wednesday at 7 p.m. However, because of the shutdown, we haven't been having it. So, but we have a lot of information, a lot of knowledge. We have amazing doctors here, and I learned so much from all these doctors that are in here. And I'm like, it just drives me insane that we can't get the message out. So that's why we're doing this webinar, and that's why we're hosting it for free, because this is going to be valuable, and we believe in providing value for people. So let's get started. Today we wanted to talk about muscle testing, because a lot of questions, a lot of people email me, a lot of people DM me, I'm sure with Dr. Blair and with Dr. Casey as well, is just people asking us, like, what is muscle testing? What's this like weird thing that you're doing? I don't get it, I don't understand it. Is there science behind it? Going through chiropractic college, that was like the common questions, right? Like, what is this? Is there science behind it? Why does it look so weird? What does it do? And so we wanted to sort of demystify it, explain it, and go through and just dissect of the knowledge behind it, and explain like why this is actually the most powerful, this real-time, cutting-edge diagnostic tool in holistic medicine. And we've seen nothing like it before, and that's why we got into it. And when we first saw it, we thought it was bizarre as well. But we've came over like years learning this stuff. We've came to realize that, wow, this is actually the most amazing thing, the most amazing technique that we can utilize, most amazing tool that we can use for our bodies. So I'm going to start it off with some questions, just some common questions that I wanted to ask these docs, and some questions that were reflected back on to me. So, let's start out with Dr. Blair. Ladies first. Why are you a holistic doctor? How did you become, who you are, and why do you do what you do?
Great question. So it all goes back to high school for me. I grew up playing, I was a sport athlete in high school. I played softball, basketball, I swam, and I ran track. So very active, constantly busy, just was always very conscious of my body and staying healthy, keeping it healthy every way possible. So I saw a chiropractor throughout high school. The first couple of chiropractors that I went to, they were great. They manually adjusted me, and I felt great afterward. It wasn't until I was in my junior and senior year of high school that another chiropractor took our basketball team in and mentored us and kind of showed us how nutrition can play a huge role in our health and keeping us healthy and strong and playing at our best. So with that nutritional input or component of our health, she introduced muscle testing, and she had great visuals showing us, like if you hold up or if you put a Coke bottle in your hand, she showed us how much sugar is actually in a bottle of Coke. Mm-hmm. And with that bottle of Coke and us holding it, if we tested a muscle, it doesn't matter what muscle was tested, they all went weak, because that bottle of Coke with all the sugar and all the chemicals inside of it, it weakened our body from the inside out. So it was just a huge wake-up call for me to realize there's something to this stuff. There's more than just, adjusting. You also have to take into account the chemical and the nutritional, emotional aspects of health. So that's how I got started. And I never looked back since. I always knew that from that day, that's how I wanted to practice chiropractic.
Amazing. Dr. Pride?
Yeah. So I was born into a chiropractic family. Both my parents were chiropractors. My mom did functional medicine in addition to chiropractic. So I grew up with this sort of holistic health philosophy. It's all I knew growing up. I was so healthy growing up as a result of getting checked and adjusted regularly and being mindful of what I ate and everything else our parents had us do. And I was so healthy that I thought it was weird. And I want you to try and imagine that for a minute, being so healthy that you like don't quite fit in. And that's what my reality was growing up. And chiropractic ended up calling to me later in life. It's something that's become a passion for me, being able to pass that same gift that I have on to others. But what got me into muscle testing was I was in chiropractic school. Neither of my parents muscle tested. I'd never seen it before. And I had a severe, like constant pain in my neck from martial arts that I'd had for a long time that nothing had helped me with. No kind of manual therapy, no chiropractic, nothing had helped it. And there was an applied kinesiology doctor who's still to this day, still a very good friend and mentor, Dr. Scott Huff at Functional Health Institute, gave me an adjustment that changed my life using muscle testing. And from that day on, I said, I have to learn this stuff. I went through the entire certification, and now it's what I use in practice because it helped me so much.
Wow, yeah. That's amazing. But your parents, they're not. They don't do much.
They didn't. No, they both passed away. When they were in practice though. Neither of them did muscle testing. It wasn't part of their practice. It was something I wasn't exposed to until I was in chiropractic school.
Got it. Yeah. Same thing. I never got exposed to muscle testing until chiropractic school. I was supposed to do physical therapy. Then I did personal training. Then I signed up for massage therapy school. Then I was like, I don't want to do that. And then finally I found chiropractic, and I thought I was going to go into chiropractic school, adjust people, right, and do soft tissue work and send them on their way. And then the first week there was club week, and I went over and I was like, hey, what is this applied kinesiology club? I am a kinesiology major, or I was. I'm very interested in this. And I remember the guy, he was a great mentor through my student days to me. He was like, this is nothing like kinesiology. I'm like, oh, okay. And then he was just like, just come by club, next week. I'm like, all right. So I did. And then, he was like, hold up your arm. He showed me the arm test, tested different muscles. The thing that blew me away, the thing that clicked and just completely got me was he tested my psoas muscle. If you guys don't know what that muscle is, psoas muscle is your big hip flexor, right? There's other hip flexors in there, but your psoas attaches from your entire lumbar spine all the way to your femur, right? So it's a very important muscle. It's related to the kidney. Anyways, both of them were weak, and I was like, oh, dude, I work out. I'm an Olympic lifter. There's no way this is weak. And he was just testing, no, it's weak, man. And he was like, I'm going to turn it on. And he adjusted my occiput, and it turned it on, and I felt the difference, and I was just mind blown, right? And it was crazy. So over the time, that's how I got introduced to it. And when I started learning, it was really the structural component. And then I started learning, there's nutrition, there's emotional work all tied in. I was like, this is the type of doctor that I wanted to be. I wanted to be comprehensive, right? And I think we all resonate with that, right? We want to deliver comprehensive, individualized healthcare, true healthcare, that really is taking the guesswork out of so many things. I mentioned that earlier to you, Dr. Blair, is that we have so many resources. There's so many tests. There's so many things to refer to, such as your family or your mom. She did functional medicine, which traditionally uses a lot of lab work, right? So blood labs, salivary tests, hormones, stool samples. So the challenge is that, I don't know if you guys, but when I look at someone's lab work, especially my dad, because he has problems, but there's 50 things that are off, So, I guess, Dr. Blair, would you go into that challenge of how does, one look at the lab work, and why does muscle testing help kind of streamline us in that sense?
Sure. So, lab work can be pretty overwhelming if you don't know what you're looking for. We like the full blood panel just so we can get an overall picture of what your body is doing as a whole. But sometimes we don't really know what exactly the priority is or what needs to be worked on first. Because the priority thing is like the biggest problem. That's what you want to focus on, so that everything else afterward will kind of fall into place. So with muscle testing, we're able to look at this lab work, see as a big picture what's going on, all of your different lab levels, your thyroid levels, your liver, all the different enzymes, all the different things that we test. You can look at those levels with a numerical value, and then you can also kind of not guess where to start, but you can take that and look at your body and say, okay, I'm going to go and see the reflex for your thyroid and see if this reflex shows up with muscle testing and see if it's a priority. If it's not, then you know that the thyroid maybe isn't the first thing that you need to go and work on. Maybe it's the brain or the heart or the liver or any of the other organs. So with muscle testing, that's the coolest thing, is you know where to start and in what order you need to work on your organs and the different things in your body so that you can get better faster.
Awesome. Perfect explanation of why, like I said, there's 50 different things, right? It's oftentimes confusing. It's confusing to the patient. Not only that, patients are humans, doctors are humans too. If it's confusing to the patient, it's probably going to, at some point, be confusing for the doctor. So the doctor, what we're taught is to look at all these things and then make an educated guess, right? If you're doing a study, it's called a hypothesis. If you're in practice, it's called a diagnosis, right? Diagnosis means two people. Gnosis means you don't know anything. Two people not knowing anything. So really, it sucks, but it's a lot of guesswork, and that's kind of the challenge. Not to say like you shouldn't look at that blood work, but what we do is we look at the blood work, we look at imaging, we look at MRIs, we look at X-rays, we look at the stool samples, we look at hormone testing, and we see that, wow, and then also the patient history, and we combine that all together, then utilize muscle testing and prioritize everything to find out exactly, like, how do you connect all the dots, right? So thank you for that. That was a perfect explanation. We're going to keep rolling through. So let's explain a little bit about, a lot of people want to find out is there science behind this? How do you explain this in scientific terms? I know Dr. Pry, you are a big neurology guy.
Yeah.
Would you care to explain to us, like, scientifically what's kind of happening, neurologically what's happening?
Sure. So the way I look at the muscle test is it's kind of a window into what's going on in your system. Like you touched on, Blair, with the lab work. Lab work is sort of big picture. Here's the sort of overall state of the body, and based on that lab work, you might recommend certain supplements, certain vitamins, certain nutrients, things like that. But you really don't know the effect they're going to have until you redo the lab work, weeks or months later to see, okay, it was the right supplement, it was the right nutrient, it was the right drug, whatever the recommendations made based on that lab work. The muscle test allows you to introduce a nutrient, a force, anything into that person's system and see how they're going to respond before you even give them that recommendation, before you give them that supplement, that adjustment, whatever it is. So you know the exact effect a specific thing is going to have on their system before you have them do it. Okay, so the way that the muscle test is just a simple gauge of how the body responds to a stimulus. So for example, if I have you hold your arm up here nice and strong, push up against my arm here, that's really strong. Okay, now if we input some sort of stimulus to Calvin's system, for example, if I give him some pressure on his neck here and have him hold that up again, that shuts him off. So what just happened when I put pressure on his neck is we just changed the energy dynamic in his system. And we just changed the energy output he was able to put into holding that arm up, right? Just by introducing a force into his spine here. So that's information. That tells us that if we make an adjustment here, we know what the effect is going to be. So hopefully that kind of answers the question.
Yeah, no, and that's a really simple way of explaining it. I love it. Dr. Blair, you got anything to touch on that?
I think Dr. Casey covered it perfectly.
I know, right? It was awesome.
Yeah, perfect.
So with that, there's a lot of art into it, and I just want to say now chiropractic. It was all based out of chiropractic. Chiropractic philosophy is that it is a science, it is an art, right? Philosophy, science, and art. That's what it is, right? So you got to know your why you're doing it, and that's really important, right? And for us, I think we all have a really strong why. We want to help people, change the world, change people's lives. The other thing is that we know the science, right? Do the work that we do in functional medicine and applied kinesiology and quantum neurology and neuroemotional technique and all these things that we've studied, it requires a lot of knowledge. It requires a lot of studying on the side, you know? So all this stuff that we talk about are actually not taught in schools, you know? So we spend, a lot of time, spending a lot of money and time, perfecting that. And that's where the art comes from, is practicing over the years, practicing on each other. So that's what I wanted to say about that. Dr. Blair, just to segue into, talking about a little bit more about, muscle testing and why it's beneficial. Like, what do you want to add into that, like into the care?
So with muscle testing, I think it just allows it. Can you guys hear me?
Yes.
Okay, just making sure. So muscle testing is like we said before, it's another tool. It's another here and now immediate way of asking your body what it needs and giving it to it and seeing how it responds. Like Dr. Casey was saying, he said it beautifully. With that being said, there isn't just one thing that could immediately turn on any muscle. There are a million, like anything can cause anything, right? So if we see that a muscle is weak or it falls or whatever you want to call it, or is inhibited, we know that there's something going on there. We just don't know what. So as kinesiologists, it is in our training to kind of investigate and see what's going to make this muscle stay strong, or what is going to make it go from weak to strong. And that's where the triad of health comes in. That's where we look to see if a structural cause is there, or if an emotional cause is there, or if a nutritional cause is there, chemical cause is there. We see that it's a whole big picture thing. It's not just one thing that's going to fix it. It could be a combination of different things. But with muscle testing, it tells us in live action right there, and person to person, patient to doctor, what that person needs right then and there, and what is going to help them get better. Did that answer what you wanted me to?
Yeah, no, that's great. Okay. I love it. It's great. And just to add on to that, and that, perfect. Muscle testing is not really anything new. It's just new to the general public, I would say. But about more than 80 techniques actually utilize muscle testing or some form of it, right? We know that there's so many different doctors, practitioners, ologists, whatever, they use muscle testing as well, so from psychiatrists, psychologists, physical therapists, personal trainers, nutritionists, chiropractors, medical doctors, right, naturopaths. A lot of people in those fields, now there's not a whole lot of them, but muscle testers are all over the place, and they're used across many different applications. Actually, in Korea, there's a very famous medical doctor, who actually has taught many people to use muscle testing as a tool, and they actually go and find tumors, right? And that's crazy. I don't know if I haven't gotten training on that, but that just shows you like how cool the system is, and what it does, and how effective it can be, and anybody want to touch on, like, I guess what makes it so powerful? Like, what makes it, why, like, sometimes when you look at lab work, sometimes when you look at imaging, some things will slip through the cracks, right? Like, you know, patient says, I still have pain and I still have discomfort. I still feel fatigued and I still have these symptoms, but my lab work looks completely normal. My imaging looks completely normal, you know, but on the muscle test, sometimes we find that. Anybody want to, like, you know, chime in and explain like how that phenomenon happens?
Yeah, I can jump in on that.
Sure.
Well, the really cool thing about the muscle test is it's a window into what is going on with you right now in this moment. A lab test, you know, it's a window into what is going on in your system, you know, after 24 hours of fasting, and it's at 6 o'clock in the morning, or whatever it is the circumstances are that you get the lab test, that's what it's measuring your state in. The muscle test, it's testing you as you are right now. And it's specific, and it's very, very precise. And the beauty of it is there's no guesswork at all. There's no guesswork at all. You know what the effect is going to be of whatever you're testing for before you end up doing it. So it allows you just a higher level of certainty. And, you know, as a doctor, that's important for us. We want to know that what we're going to do is going to work. We want to be as close to 100% as possible on that. And the muscle test allows us to be as close to 100% as possible on that, to do a test before we make the recommendation. Because if you're not testing, if you're not measuring, you're guessing. It might be a good guess, it might be an educated guess, but it's still a guess at the end of the day. And the muscle test completely takes the guesswork out of it.
Guys, I think this might be a good time for us to kind of show what we're talking about. So like, say I'm coming in and I know there's something going on with my stomach, but there's nothing showing in my blood work. What would you do to show or to figure out what's going on with my stomach? Can you guys show us?
Yeah.
I would have said I don't have anybody else here with me.
Yeah, I'm gonna, like, we'll do this. Let's see, making sure the camera's all good. So let's just go back into like what muscle testing looks like. We saw what Dr. Casey did on me, and that was great. So that's one form of muscle testing, right? This is called like the straight arm test, right? It's a general muscle test so that I can see what the entire system is doing, right? So I'm not testing how strong he is. I'm testing like whether his body can actually adapt or respond, right? Quickly enough. I call it a firing speed. You know, what's the speed of response? So if I tell him to push, right? If I tell him push and then he can resist quickly, then everything is good, right? So that's a test for like as a general test. Now, Dr. Blair, you mentioned about stomach issues, right?
Yeah,
So
sorry.
Go ahead.
Say I've been bloated for a couple of days. Where would you look?
Yeah. So logically, right? So if I'm just guessing, I'm gonna be like, well, let me check the stomach, right? So let's check the stomach to see what's going on. In applied kinesiology, the stomach relates to a few muscles, right? There's gonna be one big muscle here. It's called the pectoralis major clavicular division. Just a big bunch of words, but this is how it looks like. I'm gonna have him turn his hand down like this. Actually, it's probably better if I do this. So this muscle it's basically your pecs, guys, your pecs. And I'm gonna tell him to push straight across, right? So I'm gonna push here, push, right? And Dr. Casey is good, right? Now, it doesn't mean that he doesn't have, and let's just say like, you know, he does have stomach issues, right? That may not be the number one thing. That may not be his root cause, but I'm still gonna check it, right? So this is a way for me to check. Otherwise, I would just be like, oh, well, you have bloating? Let me give you some stomach acid. Well, if I'm testing here and, you know, the muscle neurologically relating to his stomach doesn't shut off, it means that his stomach is actually working right. Maybe there's a small intestine issue, right? However, I wouldn't know that unless I test. Does that help, Dr. Blair?
Yeah, definitely.
Okay,
definitely.
Cool. Yeah, so that's the pectoralis major. So I would test, so go ahead and don't resist, just let it go weak. And so this is how it would look like if it was to go weak, right? It would, like, he wouldn't be able to adapt. Now, I can make it go weak. And how we can do that, there's one spot on every human body. It's a party trick, but it's where energy goes in and out of. He's just gonna hold that spot right here, and I'm gonna tell him to push again. And when he pushes, now he can go. Even if he was to try really, really, really hard, it's gonna break down, all right? So that's what a weak muscle will feel like. Going back to small intestine, we can also test an individualized muscle. Small intestine muscle is gonna be this quad here. So anyone who has hip flexor, hip issues, knee issues, right? It's not as simple as just a knee or hip issue. Sometimes if it's chronic, it can relate to an organ, right? So this is a quadricep right here. So I'm going to test this. Just give me a little bit of a bend. Yeah, there you go. So the quadriceps is responsible for kicking the feet up, right? So I'm going to move this down a little bit. So I'm going to push down here, and that's pretty good. If it was weak, let's just say, it would go like that, right? Okay. So if you guys been muscle tested before, you guys know what I'm talking about. So that's basically how that's the gist of how we test different muscles. You might have gone to an orthopedic doctor, physical therapist, or a chiropractor who's done a proper neurological exam where they tested muscles, but they were testing strength, which looks something like this. They count 1, 2, 3, 4, 5, but I'm not applying any more pressure. And that doesn't give me information because it's not a dynamic stimulus. We're introducing a very dynamic stimulus, a changing stimulus, to see how the body can react and adapt. That basically is testing to see if he's actually got a nerve and a muscle that is, properly intact and working right. So it doesn't give much information. But the way we test with applied kinesiology, we can gather so much more information with what the body is doing. Dr. Blair, anything else?
I think you did a great job of, explaining that. And did you maybe want to touch on the different reflex points relating to the organs, or do you want to save that for a different time?
No, we can. So, we can use a live. Do you know anything that's bothering you right now, or?
Gosh.
We're gonna test for it.
Yeah, look, see
Okay. Yeah.
Don't have any complaints with that.
So I'll show you guys, since last week we did a lot of like arm muscle tests, we're gonna do more like, we're gonna do like a full body thing. Yeah, go ahead and lie on your back. Dr. Blair, just let me know if if the video is good or if it's capturing everything.
Yeah, that should be perfect right there.
Okay, cool. So I'm just gonna do a general check. I don't know what's going on with him. I'm gonna do a general check of what's going on, okay? So this is a quad, or this is a rectus femoris. It's related to a quad, so hip flexor muscle. Go ahead and push towards your nose. That's pretty good. This is another quad muscle. Good. You're gonna drop it down here. You're gonna lift the toes up. Bring your heel to the butt. Don't let me pull. Go, go, go. Good. Okay. Keep it straight. Good. This is the psoas muscle. Okay. Keep that straight. Hold on here. Relax the feet and push. Hold on. Hold on.
Go.
Yep. Keep that straight. Go, go, go. All right. So
you found a winner.
Yeah, so watch this, guys. I mean, this is super important. Go ahead and flex the dorsiflex the foot here. All right, push here. It's not going to show. So there's ways that people can cheat on the muscle test, right? That is really subtle. So this is why that's the art part of muscle testing. I don't know if that was relevant, but I just wanted to show that real quick. So it's straight. So we always pride ourselves in doing the proper testing and proper work, right? So looks like Dr. Casey here has a weak psoas. A weak psoas may mean, I don't know, maybe he has a structural issue, right? Dr. Blair, what are some structural issues that can be related to a psoas weakness?
He could have an upper cervical fixation, which is basically the skull of his head, and the very first vertebrae could be stuck together out of place.
Great. So what he's doing, he's here, you can explain what he's doing. He's touching the,
So he's touching the occiput and the atlas, which are the top two bones of your head and your spine. And just by him touching it, it strengthens that psoas muscle. So what does that mean?
so that basically means that there's something going on at the cervicals where I should take a look at. Most likely it's probably it's a fixation. He probably needs to get adjusted, right? So that's how this, it's called therapy localization. Basically, it's just touching to see whether it will change the muscle test, right? So in that case, it does. Now, let's just say that didn't show. Let's pretend that didn't show. What else can I check?
Maybe he's dehydrated.
Oh, there we go. So we can check for dehydration. That's at the tip of the nose. So he can touch at the tip of the nose. Keep this straight, hold strong here. So if it doesn't change the muscle test, then it means that maybe he's well hydrated. It's not the current problem. What else can I test? Kidneys, right? So go to the kidneys, the kidney reflexes. So he's touching his kidney reflex, kidney organs, right? And it's basically saying, hey, does this psoas, is it related? Do I need to address the kidneys in order to make this function better? And this is, he does martial arts, so it's important that his muscles function well. Hold strong here. So it doesn't. So it's not his kidneys. So he probably just needs to get adjusted, Okay, you can let go. Anything else I should add?
So if we went through all of those things and we still couldn't find what strengthened that psoas muscle, there are a bunch of different things you can try to get it strengthened. It could be something to do with his nervous supply to his cardiac organs or his neurovascular system. It could be related to his lymphatic system. It could be related to the acupuncture meridian system, or it could be an emotional issue, or he may need a nutritional supplement for his kidneys because the psoas muscle is related to those kidneys. So with all of those different things, we can, again, prompt the body to see what brings that psoas muscle from being weak to being strong.
I love it. So that's perfect. So we just checked his emotions, right? We had the hand on the forehead. Why is it on the forehead? Because we know that if people who are stressed have an emotional reaction. They go like, oh my God, can't believe it. So naturally we do this to, it's therapeutic. Also, it's your frontal brain, your frontal lobe of your brain where all the emotions reside. Anyways, so we found out that actually two things helped Dr. Casey's psoas muscle. It was number one, adjusting his neck, and then number two is getting rid of the emotion. So normally, let's just say we weren't testing, we went and adjusted anyways, right? It's a lucky guess that we adjusted the cervicals, and magically it turned on the psoas, right? Now, what happens, Dr. Blair, what happens if we don't address the emotional piece?
The psoas will just become weak again. Next time he got up and walked around and we retested, it would be back to its weak or inhibited state.
Yes, exactly. So, perfect. Anything you want to add?
As far as emotion goes, so emotion's going to find its way out one way or another. Either we're going to process it in a healthy way, which is ideal, or we bury it. And when we bury it, it's either going to come out as a behavior, an addiction, or disease. It's going to find its way out one way or another. It's going to affect our bodies. So processing in a healthy way instead of burying it is the answer.
Perfect. Awesome. So, yeah. Anything else we should touch on? I think that was pretty good, like most of it.
Yeah, that was perfect.
Awesome. Cool. So yeah, so that was a demonstration. Obviously, so like what happens is normally I would treat him right now, but there's so many other things that are going on, right? That may not be the first thing. Another thing is something called priority, right? So I don't want to go into that, but there's ways that we can, as muscle testers, we can check what is the priority thing to fix on the body. And that's sort of like the onion example. So, you know, you can't just go right in the middle. You got to peel the onion layer, you know, one by one. So I don't want to just treat them before I do everything else, you know, because that will take a long time, just clearing emotions and things like that. However, we wanted to show you, you know, what we do, what it looks like, what muscle testing looks like. And, you know, I guess if there's anything else you guys want to add, you know, I think that was pretty good. I think, like, you know, I think you covered most of the information. If there's anything in the crowd that you guys want to add, I don't have all my feeds, you know, I don't know if there's comments out there, but we can quickly check. Todd, if you have anything to add, Todd.
Can I say one thing real quick?
Go ahead.
I would say that if you haven't experienced this for yourself, if you haven't been adjusted in this way by a chiropractor or had applied kinesiology done or muscle testing done, I would encourage you to try it, especially if you have a health conflict, you have something where you've plateaued on, you've tried other things, and they just haven't been effective for you, and you haven't been able to get over that hump. I would get in here, man. I would get in and see these guys. It's powerful work, and it's a powerful tool to find exactly what's going on and how to best move forward. So if you plateaued and you're not seeing results, or if you have a health problem and you just want to try something that is extremely effective and very safe and holistic, this is your answer.
That's perfect. And we all do different things. We all have a different emphasis, right? You know, like for me, I really like testing individual muscles and going in there and fixing things because, you know, like a lot of athletes, they love it. They love feeling like a psoas turn on, right? That's how I got hooked on it. They love feeling like, oh my God, like a pec muscle or external rotator, right? If you're an overhead athlete, they love feeling the difference, the immediate difference between, you know, pre and post. You know, a lot of times you go to the doctor, you go to the chiropractor, you go to the practitioner, you get a therapy done, you get a treatment done, but you don't necessarily get to feel the immediate effects. And muscle testing is so cool because you can see the immediate effects of you know, after the treatment. Dr. Blair?
Yes. So just like these guys said, I mean, I don't know why everybody hasn't already been calling in to schedule their appointment. Y'all did a great job of showing and basically showcasing what muscle testing is. I personally have seen amazing results just by being treated by these guys and seeing the profound effect that muscle testing and neuroemotional technique and quantum neurology and all of the different techniques that we do inside of our office. And I see the effects that it has on all the patients, and they're all so grateful for this work. So I highly encourage everybody to call our office. If you have any questions, we would love to answer them, but we'd more importantly love to treat you. So it doesn't matter what you're going through right now, what anybody's told you before, as far as your health issues go. We want to help you get well. So just call our office and schedule your first examination with us. We'd love to see you.
Perfect. Thank you so much. And yeah, and we just had a question from Todd, and he was asking, what's the frequency of getting muscle tested? I mean, you can get it muscle tested anytime, but to get treatment, we recommend actually at the minimum weekly. That's what we like. In fact, I get treated like probably 3 times a week, even though I don't have much going on. And the reason why is because I want to keep my body at tip-top shape and really healthy, right? There's so many things that we're exposed to, right? The moment I walk out of here after getting treated, I'm exposed to different toxins, pollutants, right? And there's so many emotional stress that can be going on. So I want to make sure that my body is in optimal performance all the time. And that's what really this is about, optimal health webinar, right? So as often as possible, but at the minimum every week is what we like to do. Dr. Casey?
I would say it depends on the individual. I personally choose to get checked about once a week at least, but it's going to depend on you. It's going to depend on the level of physical, chemical, and emotional stress you're under. It's going to depend on how healthy you are. It's going to depend on how old you are. It's going to depend on a lot of different things. And so one thing that we'll do here is we make sure we test you specifically as an individual to see what you need. And that might be weekly, that might be more frequent than that, it might be less frequent than that. It's going to depend on you.
Awesome. Hope that helps you or hope that answers the question, Todd. We always say we test everything. So but yeah, it doesn't hurt to always get treated and making sure your body's in tip-top shape as well, because there's a lot of stuff that's out there we're always exposed to, and we got to make sure our body is strong. There's nothing we can do about the environment that much. We're doing our parts, right? Make sure you recycle, you're doing your part in keeping everything clean. But it's gonna happen. 5G is here. Radiation's all over the place, right? Pollution's all over the place, right? There's chemicals sprayed everywhere. Our food system, our water supply is all contaminated, and that's the reality. So what can we do? We can't complain about it. What we need to do, the best defense is the best offense. We got to make sure that we're going to strengthen our bodies first. For young people and older too, can you be too young to incorporate or old to benefit? Dr. Blair, you work with a lot of kids. You do a lot of pediatric care. So this question might pertain to you a lot more. Like, a lot of times people ask, how old can my child be to get muscle tested? Do you want to touch on that a little bit?
Yeah, definitely. So I've noticed that kids, there's no set age for when they can start to be muscle tested. It kind of just depends child by child. I've seen most 2-year-olds able to be muscle tested flawlessly, even though their nervous systems are very much so adapting and changing every single day. They're able to understand what muscle testing is and are able to respond, and we can get accurate readings from them. And there's no age limit to benefit from it. Anybody over the age, anybody with a nervous system can benefit from muscle testing, honestly. So there's no age limit, there's no age minimum. For babies or newborns, we can use their moms and dads as like a surrogate, is what we call it. It's called surrogate testing. So we have the mom and dad, they have that really strong connection with their baby, and we're able to use them as an entryway into their newborn's body and figure out through them as like a vector to figure out what that baby needs. So there's no age range. It works for all ages. There are just different methods that we use for the younger kids. But honestly, they love it. They think it's a game. They kind of try and take away with a strength test sometimes. They don't like to lose. They don't like it when their arm goes down, but it kind of just makes it fun and a more interactive visit with the kids. So does that answer your question, Todd? I hope so.
Yeah, I think you explained that nicely. So yeah, it doesn't matter how old, doesn't matter how young. So there's another question. Seems to be doing lab work without the lab. Do you find that this seems to be no, Todd? I'll touch on that a little bit. We are not replacing anything. Like I said, we are adding this as a tool, right? So the question is it seems like it's replacing lab work, and it doesn't. It doesn't replace lab work. We don't know exactly what the numbers are doing, and we never claim that it's better or replaces lab work at all. It's tying everything together. It's a tool that kind of ties everything together. And it's another piece of the puzzle, right? So all these are tools, right? It's kind of like you got this tool belt, right? We got Jesse here, jack of all trades, he knows tool belts. So you've got all these tools, kind of like Jesse. He knows so many different things, right? He can fix it. He's on social media, and he can, fix anything, at your door, whatever. But anyways, there's so many tools that people can use to assess the body. But the challenge is when do you use that tool? Like, when do you actually use it? How do you tie it all in together and actually build a house, right? You can't use a hammer and expect to build a house all the time. You need some nails, you need some glue, you need some whatever you need. I don't know how to build a house, I don't know. But yeah, but hopefully not glue. But you get the point, is that like you can't use a hammer all the time, right? You gotta switch up your tools. So muscle testing allows you to be like, hey, is this the right time for me to implement blood work? Is this the right time for me to do a stool analysis, to take imaging, right? Should I refer this person to another practitioner? Do this person need, do they need a therapy, right? Do they need someone else to look at their care, right? So we're able to test all of that. So it doesn't replace, anything. In fact, it actually enhances the care, and our frustration is like, our passion behind it is that we wish everybody would explore muscle testing and to utilize it in their clinical practice, So hope that answers your question. One last question just for it is, and the question is there any time where the patient's body is not cooperative with muscle testing? I have an answer, but I'd like to share this a little bit. Anybody want to comment on that?
Yeah, I can take this one. There can be, the answer is yes and no. The muscle test is going to give you information, but there are all kinds of things, neurological, chemical, that could affect the results of the test. And gosh, there's so many directions to go with this. But the test itself, to make sure I'm getting your question. I think you have a patient whose body is not cooperative. So the only time someone's body wouldn't be cooperative is if, one, they're really competitive and they want to win and they cheat on the test. Okay, but I mean, as you can see with like me, you see Dr. Calvin, he'll reposition, he'll make sure that I'm actually following his instructions correctly. So if someone has the cognition to be able to follow your instructions and do what you're asking them to do, then you get good information. Now, there's all kinds of things that could change the test and make it less reliable that might be going on with their neurology and things like that. And we're also trained to kind of dig through that and really find out really what is the test telling us. But as far as the test being effective, as long as the patient is capable of following instructions and they're willing to receive instructions and receive the test, then it's really effective.
Yeah, and if they're not, that's why Dr. Blair mentioned that there can be a surrogate, there can be another person to help that process along the way, right? And again, it's not the end all be all, but it's definitely one super powerful tool, right? So, but what I found is that 99.9% of the people out there who I've tested and are testable. I'm able to test them, no problem. So same thing with what you said. As long as they're able to follow instructions, then I think it's perfectly fine. Dr. Blair, anything?
Sometimes, yeah, I've run into not difficulties testing people, but people that we do our initial screening on, and we can't get any further in our examination or our analysis because, one, the big thing is dehydration. That's like the biggest thing that can throw us off with muscle testing. We have to make sure that the people are hydrated. So step number one is drink more water. It could be that they haven't eaten in a while and their blood sugar levels have dropped too low. So maybe we need to have them eat right there in front of us. It could be that there's multiple different things that could be throwing their body off to where we're not able to get an accurate read. But that's also kind of like a thing that is the beauty of muscle testing, because right then and there we can figure out what it is that's causing their body not to allow us to get an accurate reading. So it's kind of like a puzzle. It's like being an investigator. If that does happen, we just kind of have to play with things and pull out different ideas and prompt the body in different ways to figure out what's going on so that we can get that person testable so that we can figure out what's going on, what the bigger problem is.
Awesome. Good stuff. So I think, okay, let's wrap this up. Thank you guys for being on last minute. Thank you, Dr. Blair, for being flexible with your schedule and being on here virtually. She could be chilling at home with her family and away from all this. This was supposed to be her break time, but Dr. Blair still wanted to give to us and still wanted to contribute. And so regardless of where she's at, whether she's in Hawaii or Atlanta, right now it looks like they're the same place. She's going to be here, so that I thank you for that, and thank you for being on, and look forward to for you coming back and being here live.
Yeah, I'll be back soon, guys.
And thank you, Jesse. Jesse's our behind the scenes guy, but he's been a great help for us. So thank you everyone who submitted questions to us. We know this has helped you. We know that this is really valuable. We want to keep sharing it, and we want to keep empowering you guys to make decisions. That's what this is all about, right? We want to provide the information out there, real, true information, and have you guys make the decision, right? And this to us makes sense, and we're passionate about helping others. So if you found value in this today, please, pay it forward, share it with someone, because there are people right now, taking a knee in prayer every single day, every single night, hoping someone somewhere will share with them knowledge about, healing arts like this, where they're able to find answers to the health challenges that they never found before. And a lot of people are struggling right now, especially through these times. And we just want to, we want to put this stuff out there so that we're empowering others and hoping that our voices and our information are reaching out there into the ether. So with that, thank you guys for being here. Send us your questions. You can find me on Instagram, Dr. Calvin Ng on Instagram, Cone Health Institute on Instagram, conehealthinstitute.com. Where could people find you?
Dr. Casey Pride on Facebook, Instagram, Twitter, DrCaseyPride.
Great. And Dr. Blair?
And my Instagram handle is just Dr. Blair Milo, and on Facebook it's just Blair Milo. So
great.
Guys, come and follow us.
Awesome. Thank you guys. It's a wrap. Thank you.
Bye, guys.